Advanced Clinical Procedures Periodontal Assessment Project by Jessica Stafford. Patient profile: Jack Horner, 40-year-old male, African American, drinks 4 sodas a day, lives with his elderly mother, who is his caregiver. Patient medication for HIV is Genvoya. Dosage is 1 tablet daily by mouth with food. Special considerations: most common side effect is nausea, so take consideration when adjusting patient's chair. Give patient ample time to get out of chair after appointment. Diarrhea is also a side effect, so possible frequent bathroom trips. Contraindications: do not take with other HIV medications or St. John's wort. If pregnant or breastfeeding, if you have liver or kidney problems, including hepatitis, if you take antacids, take at least 2 hours prior to Genvoya. Oral effects of medication is xerostomia. Patient is taking diazepam for cerebral palsy. Dosage is 2 to 10 milligrams by mouth, 2 to 4 times daily. Special considerations is that there may be drooling, so you will need to keep a saliva ejector in the mouth. Also, the medication can cause dizziness, so adjust the patient's chair slowly. Contraindications: patients with hypersensitivity to diazepam, pediatric patients younger than 6 months, myasthenia gravis, severe respiratory issues, severe hepatic issues, sleep apnea, and acute narrow angle glaucoma. Oral effects of medication: it can cause drooling or xerostomia. Periodontal assessment: probing depths for the maxilla. 1, missing. 2, 6, 5, 6. 3, 6, 4, 6. 4. Start here. Periodontal assessment. ADA case type: generalized moderate periodontitis with localized severe periodontitis. There is generalized 3 to 6 millimeter pocketing with localized 6 to 8 millimeter pocketing in the upper right quadrant. There is a presence of class 3 furcation on tooth number 14 and 15, as well as mobility class 2 on tooth number 14. There is a class 2 furcation on tooth number 30. There is generalized bleeding upon probing, and class 1 mobility on tooth number 30. AAP periodontal classification. Patient presents with non-plaque-induced gingivitis due to systemic autoimmune disease combined with rapidly progressive generalized moderate periodontitis and localized severe periodontitis with association to cerebral palsy and HIV and NUG associated with HIV. ADA periodontal case type 3, generalized moderate with localized case type 4, severe. Patient presents with generalized bleeding and inflammation associated with gingivitis throughout the dentition. Generalized signs of moderate gingival attachment loss is evident in documents as a progressive state of aggressive periodontal disease with generalized areas of 5 to 6 millimeter pocketing and localized 7 to 8 millimeter pocketing in the upper left posteriors, with the presence of a class 1 furcation on 30 and a class 3 on tooth 14 and 15, with mobility 1 on number 30 and mobility 2 on tooth number 14 and 15. Gingival descriptive statement. Gingival color appears generalized dark red moderate to severe with distribution from free gingiva to papilla with localized dark red moderate in attached gingiva. Gingival contour presents as localized moderate festooned and receding margins. Papilla is generalized punched out and blunted with localized cratering. Gingival consistency presents as generalized, moderate, swollen, and spongy throughout dentition involving free and attached gingiva. Gingival surface texture appears as generalized severe shiny with localized moderate loss of stippling. This slide reiterates our AAP, ADA case type, and gingival descriptive statements. Our radiographic findings show there is 4 to 6 millimeters below the CEJ for the alveolar bone, vertical and horizontal bone loss, and loss of lamina dura. Gingival image number 1 indicates punched out papilla, festooned margins, cratered papilla, shiny surface texture, and swollen gingival consistency. Gingival image number 2 indicates receding margins, calculus deposit, punched out papilla, dark red erythematous color, and cratered papilla. Gingival image number 3 shows blunted papilla, the presence of bleeding, shiny surface texture, soft and spongy gingival consistency, and evidence of linear gingival erythema. Gingival image number 4 indicates dark red erythematous color, spongy consistency, receding margins, cratered papilla, and punched out papilla associated with NUG. Dental hygiene diagnosis, ADA case type, generalized moderate periodontitis with localized severe periodontitis. Prognosis is questionable due to advanced bone loss, grade 3 furcation involvements, and class 2 mobility on 14 and 15, systemic factor HIV, and poor oral hygiene associated with cerebral palsy. Therapeutic goals: short term, chlorhexidine mouth rinse to treat linear gingival erythema, and antibiotics for treatment of NUG. Long term, we want more frequent dental cleanings to control biofilm buildup and continued oral hygiene education for caregiver and patient. Modifiable risk factors: we want to improve xerostomia from medications, continue home care instructions, and modify toothbrush grip with a tennis ball. Non-modifiable risk factors is cerebral palsy and the medication diazepam, and HIV medicated with Genvoya. Treatment planning and ADA codes. Examinations: D0150, comprehensive initial evaluation which includes periodontal screening. D0140, limited oral exam, problem focused. Treatments: D4355, preliminary debridement. D4341, periodontal scaling and root planning for 4 or more teeth per quadrant. D4381, localized delivery of antimicrobial agents via controlled release vehicle into diseased crevicular tissue per tooth. D4921, gingival irrigation per quadrant. D4910, periodontal maintenance. Prevention: D1206, topical fluoride varnish for adult. Miscellaneous procedures: D1330, oral hygiene instruction, and D1351, sealant per tooth. Treatment plan flowchart for ADA case type generalized moderate periodontitis with localized severe periodontitis. At our first exam, we will do a D0140, which is a limited oral exam problem focus. Our treatment would be D4355, which is a preliminary debridement. At examination 2, we will do D0150, comprehensive initial evaluation, which includes periodontal screening. We will have 4 treatment appointments, D4341, periodontal scaling for 4 or more teeth. We will also provide D4381 at each visit, which is localized delivery of antimicrobial agents via controlled disease vehicle into diseased crevicular tissue per tooth. At each visit, we will also provide D4921, gingival irrigation. Our follow-up appointment will be a maintenance appointment, D4910, periodontal maintenance. We will again do D4381, which is localized delivery of antimicrobial agents via controlled release vehicle into diseased crevicular tissue per tooth, as well as D4921, which is gingival irrigation per quadrant. We will follow up with prevention, D1206, which is an adult fluoride varnish. Assess for D1351, which is sealants per quadrant. And always provide D1330, oral hygiene instruction, to make sure patient is compliant and understanding of good oral hygiene. Instrument selection. For Gracie's, we will use the SAS 1112 and SAS 1314. Standard shank rigidity for light to moderate calculus removal, fine scaling and root planing, and as a finishing curette. For scalers, we have the S-Nevi1/H5 standard for anterior lingual stain and calculus removal, and interproximal and cervical anterior areas. We also have the SDCN7 neighbors, which is a furcation scaler and for multi-directional use. For ultrasonic inserts, we have the magnetostrictive Slimline 10 for gross debridement, Powerline 100 for scaling and root planing, Slimline 1000 for perio maintenance, and Slimline left and right curve, which is a probe-sized insert for light deposits and root contours. Home care recommendations. Prescription dental aids. We have 12% chlorhexidine gluconate rinse, alcohol-free, and an antibiotic. Over the counter, we have an analgesic, such as ibuprofen. Toothbrushing technique is to move slowly across each tooth, allowing the electric toothbrush to do the technique. Facial and lingual surfaces of all teeth. Type of brush, electric toothbrush with modified tennis ball handle for grip. Special instructions, brush after each meal, 2 minutes each time. Toothpaste type is ClinPro 5000. Special instructions is so that it helps prevent caries due to the side effects of xerostomia from medications. Floss and floss aids type, water flosser. Special instruction, gently irrigate tissue once daily. May combine with salt water or hydrogen peroxide for relief of symptoms associated with NUG. Interdental aids type, floss holder. Special instructions, use floss holder for better grip of floss due to cerebral palsy. Mouth rinse, 12% chlorhexidine gluconate rinse. We want 15 milliliters undiluted. Swish in mouth for 30 seconds, then spit out. Do this twice a day. Fluoride, we will get in the Clinpro 5000, which is the fluoridated toothpaste. Use this in place of regular toothpaste. Products to avoid: hot or spicy food, avoid smoking, and avoid products with alcohol. Nutritional analysis. Disease: HIV. Lowered immune system, so they are prone to infections. Condition: cerebral palsy. Can cause malnourishment due to problems with swallowing and chewing. Motor skills are compromised for self-feeding. Constipation. Add to diet: foods rich in calcium, such as cheese, milk, yogurt, and oranges. Lean protein, which strengthens the immune system. Omit from diet: hot or spicy foods and alcohol, which can irritate the gingiva. Avoid in diet: excess sugary foods, highly processed foods that can add to constipation, and undercooked foods, as HIV increases the chance of foodborne illnesses. Supplement. Vitarin. This is a natural supplement that combines 10 vitamins and minerals essential to muscle, skeletal, and neurological health for patients who have cerebral palsy.